Hello, everyone. I am so happy and excited to have Dr. Michael Chavis, who is he's my dear friend and a brother and a supervisor, a mentor. He is so much in my life, and I'm very excited to have him in interviewing him and talking about what is attention deficit disorder. What is it about? So, if Dr. Michael, if you could just give us an idea, what is attention deficit? What does it look like? How
Well,
does it work?
it looks kind of, I think to most parents, they don't, most parents don't see attention deficit until the first year of school, either in kindergarten or first grade. And then suddenly things start to show up that didn't seem noticeable before. Things like inattention, hyperactivity. When a kid is playing in the house alone or with siblings or with their friends, it doesn't seem so much like hyperactivity is a problem. But when a child has to sit for X amount of time and complete a task, and they're having trouble completing that task, it may be that the teacher is the first person who sees a problem. It may be that the piano teacher is the first person that sees a problem.
So,
Or,
what kind of problem would that be?
well, it would be an inability to focus. It might be an inability to sit still. It might be, you know, um, a piano teacher said to me recently about a child, well, she can't even sit on the bench long enough for me to teach her anything. Well, it's because uh, this little girl is having serious problems remaining still or remaining focused on anything. So that the teacher says, I tell her to read one bar, 4 beats, and she reads 1 beat, and that's it. And then she's off to something else, or he's off to something else. So that there is a great deal of energy and focus on anything else for any amount of time. And then the child might remove themselves off to something else, or start to think about something else, or start to talk about something else. Um,
How about friends? Can they make friends?
Friends, they have, many ADHD kids have friends. They're usually other ADHD kids. Um, Often children who don't carry the attention deficit disorder uh, have trouble befriending kids who do, because for kids who do present with ADHD tend to be aggressive, and other kids tend to want to shy away from that, or think the ADHD type kid, and I say type kid, is mean or difficult. And because they present as difficult or as are experienced as mean, they tend to other kids tend to shy away from them.
When you
ADHD,
say mean, what does that look like for the
they
child?
hit, they push, um, they yell, they scream, um, they leave other children feeling offended. And often they leave their own siblings in the home feeling offended. Parents tend to want to ignore it and think about it as sibling rivalry or something of that nature, when actually what's happening is that the ADHD kid is struggling to build a relationship with someone, and it's hard for them because they can't focus long enough to build that relationship. Even in a play date, for instance, other kids tend to, if they're at the diagnosed kid's house, or the kid who might have the diagnosis, other kids tend to want to go home. They tend to want to leave. And if it's an overnight stay, they tend to want to go and do anything else other than hang out with this kid.
Okay. And what does that look like for an adult? Now, if you have attention deficit as a child, you will continue having it as an adult.
Absolutely.
And
And
what does that look like for an adult? How do they cope with that and how do they deal with it?
well, adults often um, tend to present themselves as shy and withdrawn because they don't want anyone to see that they are not focused. At work, they tend to not get work done in a timely fashion. They tend to have trouble with their supervisors and their bosses, um, not because they can't do the work, but because they're unfocused and and impulsive. I think that's the word I was looking for earlier. That they tend to start a task, move away from it, go do something else, start another task, so that often adults with ADHD tend to not finish things. We see that in children as well. Um, However, in children, we tend to, as adults, find a way to help them focus. But we tend to, with adults, tend to want to be overly corrected and push them.
Mhm.
Uh, and we tend to get frustrated with adults a lot sooner than we do with children. So that the relationship around uh, relationships in the marriage, at work, with friends, adults tend to become frustrated.
So it really affects in every aspect of their lives.
Yeah,
What would you say with attention deficit is overdiagnosed?
I,
What do you say to that?
I think that it is overdiagnosed. I think that a lot of what is diagnosed as attention deficit disorder is really a stress disorder. Uh,
Mhm.
I see a lot of that in my practice. Um, a lot of people come with some sort of stress disorder for their child with their child, and adults come too, but they want to be medicated and they want the problem to go away, and they think that medication will send the problem away. It will not if it's not ADHD. Uh,
Mhm. So
I
you could actually tell if it is attention deficit or not. So if they get medicated, it's not going to go.
it's
It's
not
not,
gonna solve the problem at all.
it's
Um,
not going to solve their,
the stress disorder,
there's a stress disorder, but it will take care of the attention deficit.
exactly.
Okay. What about some of the skills they gain while they're on medication? And then they get them off medication, especially in the summertime. So with the child is able to work and focus and gain all the skills they've learned when they're on medication.
Often, what I like to do is, if the kid is an ADHD child, what I like to do is medicate them during the school year, and during the school week. If I don't want them medicated on the weekends, parents tell me all the time, "You're crazy. They need to be medicated. He's all over the place. He's making me nuts." I want to give them the medication. I prefer not to. Um, Parents sometimes do it anyway. I don't argue with them. Um, the other thing, though, is that in many instances, when we're looking at something that looks like a primary stress disorder, um, as opposed to an attention deficit disorder, um, what tends to happen is that these kids and these adults can be managed without medication. And they need to develop a certain set of skills in order to be managed, but they can develop those skills. Kids who are on ADHD type medications, who are uh, who are acquiring a set of skills, do tend to maintain those skills when they're not using the medication. However, they still tend to be, at least initially, still tend to be somewhat disorganized, somewhat impulsive, and teachers often describe them as out of control. Um, and that's often frustrating for the teacher And then the kid has a reputation because the teacher doesn't want to manage that child.
Uh,
But in instances where we can get the teacher on board with the nature of who this child is and how this child learns, then we see kids begin to flourish right away. I think there
So
are,
if you don't treat it with medication, you actually could teach your child how to be,
here's a thought.
and also if you could include the adults
Yeah,
in the same conversation. Yeah.
um, I, I think that there are 4 or 5 steps that we tend to work through as we are moving from what looks like uh, a severe attention deficit to something closer to uh, better functioning. And those 5 things are, let's talk about kids and then we'll talk about adults. But those 5 things essentially are learning how to focus, learning, in other words, learning how to pay attention. And I often say to parents, you know, I don't know if you've thought about it yet or not, but find them a music teacher, an instrument of any sort, piano, trombone, any kind of horn, because if you can begin to help them learn how to hear musically, then they become focused on what they hear. And suddenly there's a skill in place. It takes maybe a year, maybe 2 years, but I say to parents all the time and music teachers that I speak with, I say, make sure that you're teaching them not just to read notes, teach them to hear. And that's a particular musical skill. And I think that you can't really be a musician unless you can use your ear.
Okay.
But if you can hear and follow sound, then you're quite able to focus. So that's one.
Would that include with adults too?
Yeah, I say to adults, if you've never learned to play an instrument, get yourself a piano teacher. Get yourself, but not one that is focused on reading, one that's focused on oral, focused on sound and listening. So that's one thing. The other is with kids in particular, to get the teacher and the school and the teacher at school involved, and the school psychologist, because often kids are acting out in some way, and there needs to be someone who can make a safe haven for them. And the teacher is not always the person who can do that. Teacher's also not always the person who is patient enough with this particular child to do that.
And what do you do? Because, my feedback with a lot of people or parents, teachers are not cooperative.
They're not.
School is not cooperative. And they blame it on the parent. And the parent could be knowledgeable enough to say, no, I mean, my child has this and that. But school is not. So what are the skills or some of the things you could tell to parents to help their child cope with this and focus?
Okay, there are 2 things that I often say to parents. One is engage the school psychologist, but also say engage the headmaster, the principal of the school, have them, and I often ask the headmaster or the principal or the school psychologist to reach out to me. I don't reach out to them, largely because I don't always have permission to call them. And parents always feel like I might share more than they want me to share. So I tend not to call the school unless I'm invited to do so. But parents can talk with headmasters and school administrators about the nature of what they're seeing at home or what the therapist has said to them, and give the school permission, the teacher or the headmaster, permission to call the therapist. The therapist can then offer suggestions about how this particular child might be managed.
Okay.
A different child might need to be managed differently.
Okay, so each child has a different need.
Yeah.
Yeah.
And oftentimes, children, and again, we're talking about stress disorders as well. Children, someone in the family is ill. Someone in the family has left to go off to university, and the kid is feeling like they're sad that their sibling is gone, or grandma has gone back to her house and is no longer with the family. So these things create stress. And these stressors sometimes look like inattention.
Okay.
Um, and it's, I should say more than look like inattention. They are inattention, but they're based someplace else. It's an emotional base and not necessarily a biological base. ADHD is pretty much seen as biological in nature.
And you feel like it's emotional. Can you talk a little bit about why do you feel like it's emotional?
Sure. When children are struggling, they are generally caught in situations where adults have solutions to problems. Children don't. How many times has any parent said, I don't understand why you don't get this. I don't understand why you're not doing it. It's not because they don't want to. Every child I've ever met wants to succeed. But sometimes when they're yelled at or feel pushed around or feel like they're told that they're stupid or dumb, then that becomes a problem that is based in anxiety and depression, because they're told that they're lazy, that they can't accomplish anything. A young woman said to her son just recently on a Zoom call with me, she's like this, I don't understand why you can't do your homework. And the kid finally said, nobody ever showed me how. But, and she just kind of sat back in her chair and said, I never thought of that. And I thought, well, how's a kid learn how to do anything? You don't just tell them how to do. You don't just tell them, you have to show them.
Show them, yeah. And I think as parents, they're always very busy and telling their children, thinking that magically the child is going to know these things, not knowing that the parent have to really sort of teach. So meaning, having said that, if you feel like it's not biological and it's mostly psychological, what about adults? Do they sort of have to start and relearn?
I think that adults struggle with the same issue. And I think many times adults are struggling with an emotional problem of one sort or another. And it's not an attention deficit issue. It is, I'm looking for the right words. It is more or less not genetic in nature, but emotional in nature. What I mean by that is that the family history may present itself in such a way that, maybe mommy or daddy had a similar problem as a child. And it may look very well like their child is now walking around with something genetic. Not so necessarily, but maybe much more an anxiety disorder that is related to having been told over and over and over again, you're not doing this right. This is you're not acting as if you're capable of functioning. You're not acting as if you're capable of meeting this task. Um, it may well be that the child is not capable of meeting that task, or the adult. But it also may be that they are so anxious that anything that is going on that speaks to a problem in living, so to speak, is tied to um, having been set up to think that you cannot be successful, set up to think that you are going to fail. Well, if I'm thinking that I'm going to fail, chances are I'm going to fail. If I'm being taught that uh, I don't have the skills I need to accomplish something, then I'm not going to have the skills. And
When you develop anxiety, which
exactly,
which cuts down your ability to focus, and then you could easily label yourself as
dumb
attention deficit.
and stupid and attention deficit and a whole lot of other things that kids call themselves. And unfortunately, parents and teachers call kids these things too.
Right. Yeah. Yeah. I mean, because many times teachers would call parents and say, hey, your kid has a problem and I don't want to deal with it. So
Yeah,
you deal with it. And then the mother doesn't know how to deal with it, or on the parents. And then the child is immediately labeled and then given medication.
exactly. And unfortunately, uh, kids are often given medications at a level that's really inappropriate for their size and their weight. Um, and
Mm.
the other thing is that oftentimes kids are given certain medications that are inappropriate for who they are as persons. For instance, a young boy was given a medication recently um, that was way stronger, much stronger than it needed to be for him. He weighed, he's 6 years old, weighs something like 60 pounds, if that much, wet. And he's on a heavy dose of a stimulant. And I just kind of had to say to the father, get this get this kid off this medication. And the mother said, I've been saying it for weeks. I'm saying it for weeks. He's sleeping all day. I can't get him up in the morning to go to school. When he comes home, he's sleeping. It's this, and it was the medication. As soon as he was taken off the meds, he had much more energy, much more lively, and much more alert, and less inattentive than anyone would have thought. What he did not need was the medication
Wow. So that happens, I suppose, all the time.
all the time.
All the time.
Yeah.
Yeah. So with adults, I mean, what would your advice be? I mean, how do you deal with it?
Well, if it is a clear diagnosis of ADHD, I'd say some medication would be really useful. Um, and the amount of medication is dependent on one's physical size, one's weight, um, and the level of attentiveness or the lack thereof, the level of impulsivity or lack thereof. The other thing I wanted to mention earlier about um, how this looks sometimes, sometimes people start to panic and it looks like a panic attack when it
Mm.
really is not a panic attack. It is a sense of not being able to function and losing focus. Um, but
And then you go through the experience of the same feeling of a panic attack.
exactly, yeah.
Well, yeah.
Go ahead.
With adults or children that, particularly adults, what if they don't want to resort, they don't want to take medication?
Then if the diagnosis is ADHD, then there's some real hard work that's got to happen.
What would that look like?
Well, one would begin by rethinking how we think about ourselves. The first idea is to get ahead of the notion that I am stupid, that I am bad, I am dumb, that I'm incapable. And I would argue that a lot of cognitive work, a lot of cognitive therapeutic kind of work has to be done. The same kind of work that you would do cognitively with someone who's depressed, chronically depressed. And that is that they must learn to think differently about themselves. That's the first step. So that the negative thinking and the abusive thinking, I'm stupid, I'm dumb. That's what I mean by abusive thinking. I can't, I don't know how. That's the first step. But it seems to me that that step is related to first understanding that there is a problem, and then understanding that there's something that needs to be done about the problem, and then figuring out what needs to be done. I'm stop attacking oneself, stop putting oneself down, standing up for oneself when other people tell you you're dumb, you're stupid, you're incapable, so that one's self-esteem has to start to grow. That is the big piece of the hard work. The next step, and I would say that this is really true with kids, but with adults as well, adults need to, with children, offer praise when they're successful and offer correction when they are making mistakes. But in the midst of correcting, offer praise as well, so that we're always building self-esteem and we're always building self-respect, such that, and that's true for adults as well. I would say that in a work environment, the supervisor who gets the best work out of an ADHD person is that person who can offer praise and who can offer correctiveness without being punitive.
Mm-hmm.
Because the punitive, how we respond usually to people with these kinds of issues is that we want to be punitive, and we want to threaten them. If you don't get this done, if you can't get this done, then you're not going to have a job soon. Mm-hmm. That's not going to get the work done.
And with adults, I mean, what are some of the self-talk you would encourage?
I would encourage self-talk statements to oneself. I would begin by saying, let's learn what makes you anxious. And let's learn how you feel when the anxiety is coming up.
Okay.
Let's learn how you feel when you are about to be unfocused. What happens? What does that feel like? What does that look like? Which means that in the work, we've got to go back and look at the last time a person felt scattered. What happened just before you felt scattered? So that we do the detailed inquiry. We look at the particulars around a set of feelings. For instance, we do it all the time. Someone says, I'm feeling sad. Well, what's making you feel sad? Mm-hmm. But we aren't always aware initially, though we're keen on, I feel sad. We're not always keen on when I feel anxious, or keen on when I feel scattered. Mm. What brings you to that place? And how often does that happen? So that what we start to do is learn our own way of being. We learn how we are in the world, what our feeling states are. And if we can be aware of our feeling states, then we can start to correct what we think.
Mhm. And not accept, I don't know, or I don't remember.
That's never acceptable.
That's not acceptable.
That's
Yeah.
not acceptable. There is
No.
my phrase in the treatment room, whenever anyone, child or adult, says to me, I don't know, I go, if you don't, who does?
Yeah.
This is about you.
Yeah. Absolutely.
And I've had people say to me, well, you're the doctor, you know. How do I know?
Yeah.
I can tell you about me. I can tell you about my anxiety when it comes up, but I can't tell you about yours.
Yeah.
And I think a lot of times, adults in particular come to us with the notion that we will solve the problem. Can't do that. I can help you figure out how to solve the problem,
Yeah.
but I can't fix it for you. I don't know how. No one knows how. But
Nobody. Yeah.
you.
So how the individuals support themselves on the attention deficit is to be aware of their emotion in the moment,
In the here and now, yes.
the here and now, and identify that.
Yeah.
And
And
then also, yeah, go on.
you know, identify that and then ask themselves a question.
Right. Okay.
Why is this, if this thing happened and I'm feeling this way, why am I feeling this way? Do I have to feel this way? Do I need to feel this way? Do I need to lose control of my thought process because I'm anxious? We all get anxious all the time. You know, I'm thinking that it's only been recently, in my knowledge, that women have started to drive in Saudi. And I would imagine that some women driving would be anxious coming up to a stoplight or a stop sign, or some kid, some 17, 18-year-old boy is speeding past you. And you, but you get control of yourself and you get control of the car. Well, if you can do that, then you can do it any other time in your life.
Yeah. So basically, what you're saying is once you have the skill and you're able to control and manage your fears and manage yourself in a different situation, you're able to generalize that in all situations.
Sure you are. Sure you are. I think what people do is forget that they can do that.
Right. Yeah.
And as soon as they forget that they can do that, then they declare themselves helpless. And then they want someone else to tell them what to do. My aunt used to have a way of stopping her sons from what she would say being silly. She would just smack them on the back of the head. And she'd say, pay attention. And I think that we can all have a mechanism of that sort. We can say to ourselves, pay attention.
Yeah.
Or stop it. You're losing control. Pay attention.
Right. So recognize you're losing control and then talk to yourself and say, stop that.
Yeah.
And go back into
and
being
go back and restart yourself.
Yeah. And I think sometimes also attention deficit people, it's hard for them to identify that they have a problem with focus because they sometimes hyper focus. And can you elaborate on that?
Yeah, the difficulty with hyperfocus is that it doesn't accomplish very much. What tends to happen is that hyperfocus gets you stuck right here on this thing, and I've got to get this done. And then 20 minutes later, you're still stuck on this thing. The other thing that comes with hyperfocus is uh, a sense of needing to be perfect,
Ah.
getting
Mm,
it, getting it absolutely right.
mm.
Um, I often say to children, you don't have to get it, you don't have to get your homework right. Just get it on paper, and then you can go back and look at it. Maybe you don't even go back today and look at it. Maybe you look at it tomorrow or early in the morning before you go to school.
So don't be stuck in one particular
Don't be stuck in
area.
one thing. Yeah,
Yeah.
because
Have it all done and then go back to it.
yeah,
Yeah. Okay. Yeah.
um, I remember a typing teacher telling me once, stop fixing every error you make in the midst of doing the work. Type the thing and proofread it. That was before, that was, I'm old enough that that was when there were real typewriters and not keyboards. And so you kind of had to type the thing, go back and put in the corrective ribbon and all that kind of stuff. Oh, I would be all caught up in the mechanics of the machine and not in typing the document. So the document sometimes didn't get done until she finally said, Michael, stop. You're obsessing. And that's the other thing about ADHD.
Mm.
We tend to obsess.
What does that look like?
Um, my friend Richard talks about it this way. My friend Richard, who is a high school principal, talks about it this way. Oh, it looks like this, he says, just anxious.
Yeah.
Um, and the anxiety is such that you don't really finish anything because you're here with this thing and you're caught up in the mechanics of something. And then a bell rings or the phone rings and you're off doing this other thing, or you're an adult and you're cooking dinner for your family. Ever burn anything because you forgot that you left the stove on? Wonder if that's happening often enough, if things are being overcooked or burned, then there's an attention issue. But sometimes that attention issue is not about having ADHD, it's about not wanting to cook.
And you got to know how to differentiate the two.
Yep. And if you don't want to cook, the best thing to do is not cook because you're going to burn something. Um,
Yeah.
but but if if you have ADHD and you're cooking, then as my grandmother would say about any cook, stay in the kitchen, stay in front of the stove, pay attention to what you're doing. And and this is the skill that I think most ADHD people tend to want to ignore. Stay at the task until it's finished.
Mhm.
And the thing that's really interesting about that is that with children and with adults too, we set short-term goals. Can you do this for 5 minutes?
Yeah.
And then go and do something else. And can you come back and do this for another 5 minutes?
Yeah.
Then go and do something else. Then come back. Um,
And that would apply also for adults.
yeah.
It just makes me wonder with adults and having an attention deficit, how much would that affects their romantic relationship or marital relationship?
Um, I'm going to try and not be crass. We know I can be. But I asked a young boy, not so young, 14-year-old boy, about the biological needs of a 14-year-old boy. And he said, I don't do that. And I said, really? That's unusual. Most 14-year-old boys are actively engaged in that. And he said, I can't pay attention long enough to finish. And as his doctor, I kind of said, well, then a little bit at a time. Um, I think that what we have to do with the attentive portion, the inattentive portion of it, is encourage people to keep trying. I think a lot of people think that they get medication and then they don't have to keep trying anymore. But the truth of the matter is, you still have to keep trying.
Have to, even with, yeah. So basically what you're saying is, if we could use the example of the little boy, the 14-year-old boy, even if there is a bodily sensation and gratification, that's not enough for him to work at
No, it's
attention to
not
that.
because, he said, oh, I'll hear the TV and my mind will be changed.
Mm.
Or the front door will open and it'll be somebody coming in the house and I'll change my mind. And he actually literally covered his face like that. And my response was, you don't have to change your mind. Just have to make sure you have privacy.
Okay. So teaching this child something that is very obvious to an adult, how to do it. Now, how would that translate teaching an adult to that is something very obvious, an adult
Well,
who wants
I think that when you're in the mind state that is an inattentive place, then it's not obvious, which is why it becomes important to look at the instances just before you lose attention, or the instances just before you lose focus. Or so what happened? What took your mind away? Why did it go away? Well, I don't know. If you don't, who does? It's your mind, after all.
Mhm. Okay, so take responsibility, basically.
Or
Take
at least own it.
and own it.
Yeah.
Own it. Yeah, own it and recognize it and understand it. And that becomes the individual work that an adult needs to do. And as a parent, that becomes the parent job to teach the child things that are so obvious.
Yeah. Without, I have to say this, obvious to the parent, not to the child.
Not to the child, yeah.
Which means that then you must teach the child in a very, very respectful and caring way.
Yeah.
Because if you teach them by saying, oh, this is stupid, you know how to do this, then what you've done is attack their self-esteem.
Right. Even if the child showed that they could do it in other times, you still have to teach the child how to, because some of the parents would say, well, I know he could do it. He did it at this place and at that,
Yeah.
You still have to verbalize it and teach the child.
Patient of mine, the parent of a patient of mine, they own a boat. And for some months, this was in the winter and they weren't using the boat, the mother was trying to get this 15-year-old boy to clean his room. And he said to her one day, I don't know how. And she said, I'll get you, to herself. I'll get you. And she waited until spring when they were out on the boat, and the father said, swab the deck. And of course, the kid loves the boat. So he's cleaning the boat and he shines. And the mother took her phone and filmed it, videoed him cleaning. And she said she didn't have to wait long. She got home. They got home that weekend. And she said, it's time to clean your room. It's a mess. And he said, I don't know how. And she said, come over here. I have something to show you. And she showed him the video that she'd taken of him cleaning the boat. And she said, if you can do this, you can do that. It requires a rag, a broom, a mop, the things you know how to use on a boat.
Mhm.
But she didn't go the route that she could have gone if she'd gotten frustrated. She could have yelled and screamed, well, you cleaned up the boat. Why can't you clean up your room? And put him down.
Mhm.
But see, you know how to do this.
But she also taught him what he did.
Yes,
Yeah.
exactly.
Even though he did it automatically, but she also told him what exactly he needed to do it, you know.
Exactly.
She did generalize that if you could do this, you could do
You
that.
do that. No, you
Right.
need a mop, you need a broom.
Yeah. Yeah. Wow. I think we could sit down and talk forever about this subject
Yeah,
matter.
I think so too.
Yes, and I can't even begin to thank you. And I know that that is your area of specialty. And I mean, no, I'll take that back. You're specialized in so many things, and I could confess because you're my supervisor. But that's a strong area that you're very good at.
Yeah, I'm decent at it.
Well, that's you being humble. You
Thank
know? Yeah. Well, thank you so much, Michael, seriously, for giving me all this time to explain and to make it very clear. And I am sure I'm going to have lots of questions over this topic.
you. Okay.
So we could sort of take it to the next step. But thanks again for your time and your experience and your dedication. Thank you.
Not a problem. Thank you for having me to do this.
My pleasure. Totally. Take care.
You too.
Bye.
Bye. Be good.
Thank you.